Hi, my name is Molly and I'm from Pelvic Therapy Specialists, and today we're going to be talking about urinary urgency and associated urge incontinence. We're going to be discussing what it is, how we evaluate it in physical therapy, and in general, how we treat it. First, I want to start off by introducing you to the anatomy of the pelvic floor and the urinary system. So here we've got our pelvis, and at the bottom of the pelvis you've got your pelvic floor. And the pelvic floor is a general term for 3 different layers of muscles you have down here, and 22 muscles in total. So the muscles are shaped like a bowl, and they run from pubic bone to tailbone. And when you do a contraction, those muscles lift up. When you relax, those muscles lower back down. And when you bear down, those muscles lengthen. Inside the pelvis sit your pelvic organs. Just behind the pubic bone, you've got your bladder and urethra. And then women have a uterus and vagina. And then behind that, you've got your rectum. So urinary urgency is a strong, often uncontrollable urge to urinate that can sometimes come out of the blue, but other times can be triggered with a certain activity, and we call that a trigger. Those activities can include walking through the front door, unzipping your pants, heading towards the restroom, or even hearing running water. Sometimes that urge can be so strong that it actually results in urge incontinence or leakage. There can be many causes for urge incontinence, and that is why we recommend that you see a urologist ahead of time to determine the cause and see if you're appropriate for physical therapy. In general, patients that are appropriate for physical therapy either have a timing issue with their urethra and pelvic floor and bladder sphincter, or they have tight and overactive muscles sitting around the bladder. During a typical physical therapy evaluation, we like to look at your pelvic floor and the ability to contract and fully relax your muscles. We also like to feel around the bladder muscles, such as the lower abdominal wall and the pelvic floor, to determine if they are tight and overactive. And we also like to examine behaviors around voiding, such as your voiding schedule, your fluid intake, or even the position in which you empty your bladder. Treatment may consist of relaxation techniques to decrease tightness around the bladder, various manual techniques to reduce trigger points around the bladder, and urge deferral techniques. If you have any more questions, please give us a call or visit our website.